All right, let's dive right into this. Welcome to today's Explainer, where we're going to explore this incredibly fascinating clash, and honestly, a really unexpected harmony between ancient philosophical wisdom and the cutting-edge frameworks of modern healthcare. I mean, on the surface, the cobblestone streets of ancient Athens and the sterile, bright halls of a modern hospital seem completely disconnected, right? But today, we're going to see how a revolutionary modern framework is actually translating a 2,000-year-old ideal into concrete, biological reality. To get started, I want us to challenge our baseline assumptions for a second. Did modern medicine actually forget what health means? When we think about healthcare today, we usually think about fixing things that are broken, right? Like curing an infection or setting a broken bone. But there's this growing realization that our modern medical system has become hyper-focused on simply surviving rather than truly thriving. We've engineered these absolutely incredible ways to keep the human body alive, but in the process, we might have lost the actual definition of what it means to be healthy.
Because, for the better part of a century now, modern medicine has operated on what we can call the empty definition of health. Health has essentially been flattened down to mere physical survival, just the simple absence of an immediate infection or disease. Normal lab results, no fever, boom, the system says you're healthy. But if we could somehow bring the ancient Greek philosopher Socrates into a modern clinic today, he would find this definition completely empty. Merely not being sick is a far cry from actually being well.
Which brings us to ancient Greece, and a rather beautiful concept: Eudaimonia. For Socrates, health was never just about the absence of disease. It was about true human flourishing. He believed this profound state of well-being isn't something you achieve by chasing money, fame, or physical safety. Not at all. It's achieved by actively cultivating your internal virtue. True well-being, in the Socratic view, comes from the rigorous daily cultivation of the soul, or the psyche. It's a deeply active process, not just passively existing.
Actually, Socrates took this idea so far that he viewed the physical body as completely secondary. He famously argued that the body is merely an instrument of the soul. For him, your physical vessel was just a tool you used to navigate the world while you performed the real work, the active internal investment in your own virtue and moral discipline. So while modern medicine prioritizes the body above absolutely everything else, Socrates saw it as entirely subordinate to the health of the inner self. Okay, hold on to that ancient thought for a second, because we're fast-forwarding straight to today to look at a revolutionary modern framework, the Health Capital, or HC model. The HC model uses the language of finance and economics to totally redefine human well-being. It frames health not as some default baseline you just magically return to when you're cured, but as a dynamic, cumulative stock of physical, mental, and social assets. Just like financial capital, your health capital requires constant, proactive investment through your lifestyle choices, your social connections, and your mental cultivation. And this brilliantly illustrates the striking structural parallels between these two completely different eras. On one side, we have Socrates championing Epimeleia Heautou, the care of the self, arguing that virtue is this dynamic quality you have to actively maintain. And on the other, we have the HSC model's accumulation of health assets. Both of these frameworks treat life as a continuous compounding process. Whether you're building ancient virtue or modern health capital, the core mechanism is exactly the same. True health requires deliberate, continuous investment. And all this proactive investment, it creates serious resilience. That brings us to one of Socrates' most famous declarations, made while he was literally on trial for his life. A good man cannot be harmed, either in life or in death. Socrates firmly believed that if your soul's internal stock of virtue and reason was intact, external misfortunes like extreme poverty or even execution just couldn't destroy your core well-being. He was talking about building an impenetrable internal buffer against the absolute worst the world could throw at you. Now, what's truly fascinating here is how perfectly modern biology validates that ancient philosophical stance. The HT model takes Socrates' idea of an internal buffer and translates it directly into hard science. Where Socrates said intact virtue protects the soul, the HT model shows that robust psychosocial domains, our mental and social assets, act as powerful biological modifiers. A high stock of these internal assets actively buffers your physiological system. It literally mitigates the destructive impacts of chronic stress. So your social and mental wealth physically protects your biology.
Because both of these frameworks value deep structural investments, they both harshly critique superficial shortcuts. In ancient Athens, Socrates relentlessly called out the Sophists. These were individuals selling superficial wisdom or quick-fix reputations for a fee. Today, the HAC model aims that exact same critique at the over-medicalization of modern healthcare. Both reject the whole expert quick-fix mentality. Our modern system often tries to fix chronic diseases with pharmaceuticals way after the structural damage is already done. Both Socrates and the HAC model demand we look past superficial symptoms and focus on the deep, structural sources of our well-being.
Let's shift gears a bit, though, and see how this builds, because as beautifully as these frameworks align, they definitely don't agree on everything. This is where ancient philosophy hits the hard wall of modern biological and social reality. While their systemic frameworks are remarkably similar, Socrates and the HAC model diverge pretty sharply in three key areas: their views on human agency, the biological role of the body, and the scale at which society should operate.
When we map out these critical discrepancies, we see a really clear evolution. First, in terms of agency, we move from Socrates' strict intellectualism to the HLC model's focus on structural determinants. Second, regarding the body, there is a major shift from moral transcendence to biological function. And finally, when it comes to scale, we zoom way out from the intimacy of the ancient marketplace to the massive sweep of modern public policy. Let's break down exactly what these differences mean in practice.
First up, let's talk about human agency and choice. Socrates believed in strict intellectualism. This is the idea that no one does wrong knowingly. He essentially argued that poor lifestyle choices are just a failure of education, like if you knew better, you'd do better. But the HC model takes a much more empathetic and honestly a more realistic view. It recognizes that even if you know exactly what is healthy, chronic stress and material deprivation act as massive negative modifiers. Modern science proves that poverty and stress can wear down your cognitive and physiological capacity, making healthy investments structurally difficult, no matter how much logic or education you possess.
The second major divergence is how they view the physical body itself. Socrates viewed the body as an almost disposable container. Famously, he willingly drank poisonous hemlock, prioritizing his moral truth far above his physical survival. The HC model entirely rejects this separation. In the modern framework, the physical body is an inseparable part of your health asset equation. Mental and social well-being aren't just abstract, floaty concepts. They're deeply valued precisely because they have the biological power to preserve your physical body. The mind and body are just a single unified portfolio. Finally, we have to talk about the massive difference in scale. Socrates operated in the agora, the public marketplace. He engaged citizens one-on-one, asking disruptive questions to shake them out of their complacency. The ASC model, however, is designed to be public policy. It isn't just about individual choices. It aims to reshape the entire social architecture of the state. The ultimate goal is to influence schools, communities, and healthcare systems at a structural level, ensuring that entire populations have equitable opportunity to build their health stocks. So what does this all mean when we pull it together? We see a remarkably clear path forward. The HC model effectively completes Socrates' ancient vision by applying it to modern society in 3 steps. Step 1, we absolutely must reject the empty definition of mere physical survival. Step 2, we need to acknowledge the immense biological power of our internal psychosocial assets. And step 3, we have to reshape our public policies to structurally support equitable health accumulation for everyone, not just those who already have a head start. So the crucial point here is that the health capital model is a modern, scientific reclamation of the Socratic definition of Eudaimonia. By reintroducing health as a cumulative stock of mental, social, and physical well-being, this modern economic framework gives contemporary medicine a direct path back to a 2,000-year-old ideal. It proves that true health really is about the holistic capacity of a human being to flourish within their environment.
As we wrap up this explainer, I've got to leave you with a question to ponder. How are you accumulating your health assets to build a flourishing life today? Health isn't just something that happens to you, and it certainly isn't just the absence of being sick. It's a dynamic portfolio requiring daily proactive investment. Whether you think of it as cultivating the Socratic soul or building modern health capital, the investment is yours to make. Thanks for joining me to explore this wild intersection of ancient philosophy and modern science, and I really hope you leave today ready to actively invest in your own flourishing.